The Department of Psychiatry at UT Southwestern is an academic department, and its traditional academic goals of education, clinical care, and research are really done in the context of a forward-looking vision for psychiatric research and the application of novel treatments in our field.
This department at UT Southwestern puts a great emphasis on education. Our philosophy of training is that we want to prepare residents to be able to treat the whole person.
My experience here at UT Southwestern has been, it's been wonderful. I was looking for a program that had a lot of different varying places, so community psychiatry, emergency services, VA, as well as private university hospital.
UT Southwestern were encouraged to follow our individual interests. They help foster that by allowing us to be mentored by someone who has similar interests.
We really want residents to take more and more control over building their own curriculum that we really hope will launch them in developing their own area of expertise and leadership.
Our department is really known for its research. It's known for developing new concepts about psychiatric illness, and then it's known for translating those discoveries and those concepts to clinical care.
One of the most important things that we do here at UT Southwestern as far as patient care is we take care of the people at Parkland Hospital. Our philosophy is that we need to individualize that treatment, so it's not cookie cutter medicine. We really need to get to know that individual as a person and find out what their strengths and their weaknesses are, find out what their support system is like, find out the history of their illness. And it's only once we have all of that information can we then individualize that treatment plan. One of the most exciting things here at UT Southwestern that's just come about is that we have a new unit at Parkland that provides medical and psychiatric care simultaneously. We have a psychiatrist who is named specifically to that unit to interact with the hospitalists who are taking care of those patients. And these are patients who really require inpatient level medical and psychiatric care. So that's something new and exciting for us.
UT Southwestern is a medical center that's known for research. It's known for innovations and discoveries.
The Psychiatry Neuroscience Division in the Psychiatry Department at UT Southwestern basically conducts research on the neurobiology of mental illness. There are two basic missions that we have in doing that. And the first is to try to relate some of the most fundamental aspects of cell biology that we know from numerous researchers, including many here at UT Southwestern, to the biology of the brain and how that is altered in mental illness. One of the more exciting technologies we're using now involves optogenetics, which is a way to stimulate very discrete circuits in the brain and understand their role in regulating specific behavioral patterns.
The UT Southwestern Psychiatry Department has a wonderful, diverse program of clinical research. We have very large studies looking at the genetic makeup and cause of a number of disorders, importantly autism and schizophrenia and bipolar disorder. Autism has been for a long time an under-recognized disorder. We are working very hard to pull together resources from basic neuroscience and from a diverse group of medical disciplines to learn more about this disorder, which is really almost an epidemic for children.
Here in the Depression Center, we have really expertise in treatment-resistant depression, and so we are engaged in treatment of patients with resistant depression. The work of the Depression Center encompasses all the other specialties on campus, and the collaborative approach and the opportunities, both for patients and for investigators, right from fellows and residents all the way to senior professors, is one of the biggest hallmarks of our institution.
What makes UT Southwestern special is that we have research, clinical care, and education as missions, but they're very closely connected. We would hope to make discoveries in this next 10 or 15 years that will help us understand what the diseases are and that will take us to novel treatments.
Dallas has been one of the fastest growing cities in the country, and that's reflected in the medical center, which has been growing as well. So there are all kinds of opportunities. There's a remarkable philanthropic tradition in the city of Dallas, and I've been really moved to see that among those philanthropists, there are people who are really committed to some of what I think are some of the least glamorous areas of philanthropy. It's an incredibly welcoming city.